slightly worried.
You are allowed to say that.
Hello, how are you? I am
all
allowed
right,
to
thank
say
you.
that, aren't I?
No, I have to admit, I've been watching Instagram tutorials on how to join a live, because I was thinking there's too much scope here for this to go wrong. But
There's way too much scope, but we're here and we can hear each other.
yay.
And that is all good. Oh my goodness. And I've got some lovely people telling me how to get rid of maggots that I've got in my fridge. Don't judge me. I've got maggots in the fridge. They need to go somehow. You sent me a book.
Did you like it?
Yeah. Well, I haven't got through it all yet, but I think it's one of those books that you can sort of dip in at. You can do it section by section, can't you?
Absolutely.
You don't have to sort of read it in a one-o, which is brilliant. Should we start from the beginning though, like how it all came about? And so tell me your story. What was your diagnosis and when was it?
Okay, so there are some personal trainers who work in cancer rehab who have started to work in cancer rehab as a result of their cancer diagnosis, which I think is quite it's very understandable route. For me, it's the other way around. So I worked in the NHS for 20 years in cancer services, and decided I wanted. I'm older than I look. And I decided I wanted to do something different, and I just got really, really interested in exercise and cancer. So I went to the YMCA and I trained as a personal trainer. It's getting towards 10 years ago now. And at the time it was, it's quite early. There was emerging evidence around exercise and cancer.
Wow.
But I just found it very, very interesting as a subject, something that was just waiting to grow, really. And my mum was diagnosed with breast cancer. She had a screen detected cancer. And as my project, when I had to do you had to design a project, a training program for a client to pass my first exam. And I did it for my mum. I did her a training program for her.
Did you?
Yeah.
And what were her sort of not ailments, but what did she need to get out of it?
Well, she needed to get me off her back, because I was going, Mum, you've got to exercise, don't you?
Yeah. Yeah.
She, very commonly experienced things. God, she'll kill me if I tell you too much, but very commonly experienced things, a bit of weight gain, some loss of confidence, tiredness, all the stuff.
I feel like tiredness is such a huge factor in it. So am I right in thinking then that you haven't been through your own cancer journey yourself? Yeah. Oh, you have?
Yeah.
That's what I thought. What I thought.
So, but it's just that it was a different way around for many people. So I did that. I've done this job so I've been a cancer rehab personal trainer for now 8 or 9 years.
Wow.
And then, during lockdown, when all my classes were cancelled and I thought I was going to have a chance to write that book that I've been writing forever, it was kind of April 2020, I found a lump. And it wasn't a standard lump. I'd been boxed, so I'd learned how to train people on camera very quickly, like everybody did, and I'd been using dumbbells and boxing with a couple of clients, and I thought I'd sprained my pectoral muscle. There was a kind of odd feeling, as I say, not a really tangible lump, but a something. And it turned out that something was lobular cancer.
Wow.
Yeah.
It's so unusual, isn't it? Because considering sort of the profession that you've come from, and then your own mum's journey, I don't know. It must have been was it quite a shock?
Well, I know this. I already knew the statistics on breast cancer and how common cancer is. My dad had prostate cancer as well, so it's not that there's there's not a relevant genetic history for me, but it's been present in my life for so. To be honest, I was assumed I'd get breast cancer.
Really?
I was a bit older. I was diagnosed at 51, and I'd had screening mammograms. I'd been invited for screening early as part of a trial, so I had a mammogram at 47 and one at 50, and they were both clear. So
Right.
I did not see it coming in March 2020,
Wow.
I must admit. Yeah, that was the rug pulled from under my feet, definitely. But you've been through, you know.
Yeah, no, definitely.
And
But
it's just a roll of dice, isn't it? It's just, you know.
it is. But I presumably that must have then really solidified all the work that you've been doing to help. Like you, if I wanted to see somebody to train me, you know, exercise wise post cancer, I want to come and see you, because number one, you've been working. That's what you were doing anyway. That's what your life was revolved around.
Yeah.
And you've been a patient, so you're both sides of it, aren't you?
Yeah. Yeah, definitely.
And also I think that you will understand the, you know, the side effects and the challenges, because I was absolutely floored. I did an interview today with somebody, and they asked me, how did I feel after my treatment? And I said I just felt like a shell of myself. You know, and you, it's the sort of mental, you know, trying to get yourself motivated to get back into the swing of it, but you feel so tired all the time. It's a bit of a vicious circle, really. And somehow you've got to, you start chipping away at it and breaking that cycle. And I know as well, I don't know if you're on tamoxifen.
Yeah.
Because obviously then it's all the side effects that go with that. And you know, with every best will in the world, you know, people that haven't been through a cancer diagnosis and they know that I've finished my active treatment, they're like all high-fiving me, oh brilliant, you're through it. And I'm like, you don't know half of the story. Like tamoxifen as well, that still really affects your body, doesn't it?
It does. I mean, I got off pretty lightly, to be honest, Helen. I didn't need chemo, which made the recovery, obviously the time that I spent being a cancer patient was much shorter than most people, and the recovery could be faster. And I opted to have a mastectomy partly because I didn't want radiotherapy.
Oh right, so that was a choice then for you then, so you could have that and then not have the radio.
Yeah, I mean, it was a bit 50-50 anyway. My remaining boob is only dinky, but for me, my cancer, by the way, was the shape of a dumbbell.
Was it actually? That is, oh my God, that's hilarious.
But it was really near my heart. And for me, when I was going through the decision making about, you know, there was potentially a choice that I could have had a lumpectomy and radiotherapy. But for me, the risk of damage to heart tissue through radiotherapy was, you know, I didn't want to gamble with that. So yeah, for me, my time as a cancer patient, as I say, was shorter and kinder than it is to many people. The tamoxifen is a little bit of
a gift that keeps on giving, isn't it?
But, you know, again, gratitude that for me, I can cope on tamoxifen. I could get back to exercise probably quicker than I ought to have in some regards, but I wanted to go back to it. This was right in the middle of lockdown, you know, in the very quiet bit of lockdown. But for me, going back to being able to run was so much to do with my own normality and my own, you know, how I manage my own mental health. So that had to come back for me quite quickly. But you're right, I felt like I kind of felt burdened, I'd say, more than anything. Heavy. I mean, I weight. Thank you, tamoxifen. Thank you, menopause. But I felt, dragged down a little. You feel like your posture, and I know it's not, and I've seen it in so many clients, your posture changes. You know, you don't stand up tall for a bit, do you? You kind of a bit.
No, that actually, you know, that's a really good point. And as well, I think when you've had the surgery as well, I think instinctively I sort of roll my shoulders forward more than I should. And it was my daughter actually today when we were having food earlier. She said, you should be pushing your chest out and your shoulders should be back. And it actually hurts now to do that because I think I've sort of conditioned myself to sort of, I don't know, I sort of feel like it's almost like I want to protect myself.
Yeah. Do you know what? It's something that I've observed in women who've had breast surgery for years, all the time I've been doing this. And it's so instinctive. And I know I fell into it. You kind of, you do this with the affected side. You protect it. And then there's a thing about, I guess, self-confidence and feeling conscious. I don't wear, well, if I go out, I wear a knitted knocker. But other than that, I don't. I don't wear a falsie. And your instinct to stand, you know, proud, it takes a right knock. One of the things, so in terms of what we can do about it.
Shush. Do you know what? There's somebody at my door, so I'm just going to have to open it because I don't think anybody in the house can hear it. Hang on.
Oh, brilliant.
I'm sorry. You'll have to do a
no worries. So, Instagram, what I might do then while Helen's doing that is I'm going to show you something.
Don't worry, you don't need to do a tap dance. I'm back. I
was just about to ad-lib then. things that we can do around pulling. Let me come back a bit. So around pulling the arms back. So rowing actions, stuff like this. And also this move. Hands up or down, that kind of thing. So both pulling back and purposefully rotating the arms round.
And should you have weights in your hands whilst you're doing that, or do you not need weights for that?
So this one, for most women post-surgery, is so with all of this, actually, with anything that we're doing around strength, flexibility, you work on range of motion first.
Right.
So if it's really uncomfortable to do that, then you would do a small movement to the point that it's a little bit like finding the bite on a clutch in a car. The place where your body goes, that's far enough, thank you.
Right.
You go there and you get used to there and just to the edge.
Yeah, I'm doing it now. I can feel it. And I can feel it more on the side where I've had the...
Yeah, possibly.
I had the surgery. And so I'm just trying to work out what is the best way of us, because it would be great to get some of these tips from you. Should we chat first about what you do like post surgery and then further down the line?
Yeah, go for it.
So
if you think post surgery, we're all given, I wasn't sure, is this a chat just about people joining it? Is it all people who've been affected by breast cancer, or are we talking?
No, cancer in general.
Okay. It's just, so breast patients are given a set of exercises.
But if you're more breast, though, with your tips, it can be that. I do it all.
Yeah. But certainly post-surgery, most of us are going to have been given something from the physio or something from a clinical nurse specialist. For breast, it's doing things like this, and I'm at the wrong height for you. Things like this and that, and things that are around keeping the shoulders mobile. I think lung cancer patients get something similar because it's around keeping the muscles in the upper body. If lung cancer has been treated surgically, it's around keeping the area mobile. So
what about hysterectomies if people have had to have that done?
So hysterectomy, the idea is, so if you think, you can be active in lots of ways, but the stuff that gets very specific tends to be around the muscles and joints that will be affected by surgery. So hysterectomy traditionally has been about being very careful about lifting, bending, and same for after bowel surgery, or if you've got a stoma, for the fellas who've had prostate treatment too. There's stuff around not necessarily bringing the knee up towards the waist too early, about being protective of how you move your back. And there's all sorts of variations, but as a broad brush, what I'd say is that if you're given exercises to do immediately after surgery, then if you're able to do them religiously, they pay for themselves.
So I remember when I I'd had my mastectomy. I was still in hospital, and this really sort of bright, breezy woman came sort of skipping into the room, and she was a physiotherapist. I thought, are you having a laugh? I can't even sit up at the moment.
Yeah.
And there were various exercises like you're talking about that, you know, she was just trying to get you to do. Yeah. And I thought, I can't do this. I found it really hard. And I found it mentally hard as well, because I thought, you're looking at me like I should be able to do this, but I can't do it. And she said, no, you just do what you can, but you will reach these goals a lot quicker than you think. And she was right, actually. I did do my homework, but it felt tough to begin with. But once, if you just keep repeating it, little and often, I found was good.
So I was like a total class SWAT, because I already knew everything, you know, and I'd trained people before their surgery as well as after. So I was used to, I don't know if you've seen all the work that's been done on what's now been called prehab, but it's clever. And so those movements I started doing before I went into hospital.
Ah, right.
To get used to how it feels. And I was doing them in my hospital gown before and after surgery, just gently, really cautiously, just to really get the movement back. I was really, really anxious about getting full shoulder movement back because of my job. You know, I've got to be able to do that.
Yeah.
And actually, I sort of need to be able to do a plank and weight bearing stuff and things that many women who've had breast surgery would be cautious about. I wanted to be able to get back to it very quickly. So certainly in terms of what we were saying about the sequence of stuff, I would always start with whatever we're given immediately, particularly post surgery. You know, during radio and chemo, there's some different stuff going on. But then what you can do is build up from those movements. So when you said with those things, would you have a weight in your hand? If you think of the classic where we walk the fingers up and down the wall, and if that's your first line of shoulder mobility, excuse me, I'll ask you in a minute. We go from there, and then if you think of that movement, it's actually about lifting the shoulder. So then you try to make the movement bigger. So going from there, both with the arm extended and with it up. And then these.
Oh, yeah, they're good, aren't they, those?
Yeah. So then you put a band in your hand and add a light bit of resistance. And then eventually, this looks really planned. It's not, it's just by my feet. But then it comes to here. And then you've got you add a weight. So it's strength training after cancer. Strength training for all of us is dead important.
And how did you find the strength training, like after your experience? Harder than you thought it was going to be, or did you have quite a lot of muscle memory there anyway, so you kind of like flip back into it quite quickly?
Both. And when I was waiting to go into hospital, I was exercising a lot, as I say, to manage mental health. But I upped the strength training around my shoulders, around my core, because I knew which muscles would be affected. I was surprised how much pectoral muscle I lost. So I've heard other women say this, that the kind of scarring can be almost concave, where it goes in towards your chest wall. And that does have an impact on your strength. You know, you've still got muscle memory everywhere else, but if you've literally lost muscle. The other thing that's happened to me in terms of strength training, I was listening to a chat that you and Liz O'Riordan did on tamoxifen, and I was like, tamoxifen in me has caused tendinitis, and actually tendinitis in my non-surgical shoulder, which was really annoying. So this shoulder I was being careful with, you know, from a lymphedema risk perspective, all sorts of stuff. But I've actually had a lot of pain around the back and the top of this shoulder. So I stopped lifting weights on this side too. So I've lost visibly my physio tells me I've lost muscle mass
Mm.
on my shoulders, but you know, you kind of just got to deal with what's being chucked
You win
at
some, you lose some, don't you, kind of thing.
Precisely.
So how did the book come about, and how did, and it's called, for anybody that missed it earlier, it's called Get Your Oomph Back, a guide to exercise after a cancer diagnosis. So how did the idea of writing a book come about, and how does somebody use it? Is it for any type of cancer? Is it for anybody going through treatment? I mean, it sounds to me like quite a good gift to get for somebody who's had a diagnosis, because then they would, you know, almost be giving them something practical to be looking at and reading about for afterwards. So how did it come about, you writing it?
To be honest, I'd fancied the idea of writing kind of semi-professionally for ages. And I work with the Maggie's Cancer Support Centres a lot. I very often get asked to do a talk, you know, can you do a talk about exercise and cancer? And I've been doing those for a while. Being an old-fashioned kind of girl, I would type up a handout.
Yeah.
And I did the same talk for men with prostate cancer, wrote up a handout, and people would often ask me for a sheet of something, you know, or we'd do a little workout and they'd say, have you got this on paper for me to look at? And just an idea came around to possibly look at writing a book, and I started it, and it was this huge idea. I can procrastinate at Olympic standard, so you know, it kind of, I played with it, I'd do bits and bobs, and then what I decided to do was turn it into a blog so that I could make it more bite-sized. So I was blogging for a little while, and every time I'd write a chapter or something, I'd put it as a blog post.
And then you'd get feedback, presumably, on that from people, so you know what was...
I mean, I was really, really low profile. My profile, you know, doing things like this has come about just because of having a book published. I was much lower down the radar then. But I approached a publisher. Hammersmith Health Books published my book, and they specifically, they all they do is publish books about health and well-being, and they're particularly, you know, they're a small publisher, but they're particularly interested in unpublished authors. So it just seemed like a really good match. So I approached them and said, would you like to publish my book? You know, there's a kind of formal process, and bless them, they came back and said, well, you see, yes, but it's been lockdown, and during lockdown everybody who fancied writing a book
has been writing a book.
So they said, can you go away for a bit because we're busy? And then when they came back to me, would it be kind of February, about a year ago,
right? And
they said, yeah, we'd like to publish it if you could just get your finger out and finish it. So
so are these, so somebody has been diagnosed, got a diagnosis, how is this going to help them?
So deliberately, I've done a section of the book that goes right through the different phases of cancer, right from prehab to palliative care, and talk about how exercise can impact and can help at all those different points, because it can, and there's cracking evidence right from prehab to death about how exercise can help. In particular, I talk about, for those of us that are lucky enough to get to the end of treatment, it's not always a straightforward time of life at all. And that point where you're told, you know, go away, take the pills, come back and see us in a year, can be really, really hard for people. So there's quite a bit of focus about exercise at the end of treatment for those that, as I say, that can come to the end of treatment. But very deliberately, I've got stuff in there for people with stage 4 as well, because, you know, it's absolutely part of the cancer experience. So there's that, and then there's just a whole load of practical. And I've put some evidence in for those that want to read it, because again, something that I've been very lucky in is that I already knew. I know there's published evidence to show that it can help reduce the risk of cancer coming back. I know that there's evidence to show that exercise can help reduce our risk of dying from cancer. You know, there's some very, very meaty statistics in there, although how you distill those into everyday existence, you know, there's no guarantees.
Yeah, and also there's lots of evidence based around the fact of what it does to boost your mental health as well, doesn't it? And I think if your mental health is on track, then a lot of the you know, a lot of the rest of it follows suit. One thing I really liked about this is I feel like none of your advice, the practical tips, involve spending any money. So it seems like going up and down the stairs, or it's doing things, you know, you don't necessarily have to have weights, do you?
You don't.
So that's interesting.
You can use your body weight a lot. I wanted it to be stuff that people could use, and that also felt manageable. It's not to be condescending or patronizing, but you know, the idea of exercising after cancer can feel like a massive mountain to climb. So I wanted it to be stuff that was doable. And so walking, really good exercise. It's weight bearing, it's normally free, it tends to be convenient. There's a little bit.
Can I fire a question at you? Somebody just asked a short while ago, they're a year on from breast cancer. Is using a rowing machine advisable?
So pretty much, you know, anything is advisable. Not exercising is the thing that's not advisable.
Right.
There are specific things around strength and cautions. So a rowing machine, unless, I think the only thing I'd be cautious with a rowing machine is that they're really hard work. So as a cardio exercise, you know, they put your heart rate right up. So somebody a year out of breast cancer treatment, I'd ask her if she took Herceptin, because Herceptin is known to, you know, there's a reason why you have heart scans during the treatment. But yeah, of course, why ever not use a rowing machine? Because that does stuff around the upper body, helps train the core. You use your legs. It's not weight bearing. And one of the things that we do need to...
How is it not weight bearing?
Because you're sitting down.
but you still push with your feet off, don't you? Is that not like a weight when you're pulling that thing?
The regular definition of weight bearing exercise is that you're transferring your body weight from one foot to another.
Okay, that makes sense. Because I couldn't work out why walking was, but that wasn't. So walking is because you're transferring foot by foot. Yeah. Right. Okay.
So, and it's all to do with impact. It's all to do with striking the ground, and that causes, you know, almost like little shakes through the bones. My best analogy is if you imagine filling a coffee caddy and you can't get all the coffee in, and you tap it to make the coffee more dense. That's exactly what happens to our bones. So anything where our limbs are striking the ground and supporting our body weight is weight bearing. The lady on her own machine will get really good cardio exercise, and she'll get really good strength stuff there as well. But it's important to support that with stuff on your feet. What I would say more than anything is to just do what you enjoy.
Yeah, that's true. And would I be right in saying, like, listen to your body a bit? Like, if something doesn't feel right, then stop. What about lymphedema risks?
So lymphedema, very similarly in a way to the thing about exercising after surgery. Exercising with lymphedema, and if you have a risk of lymphedema, it's not just safe, it's recommended. The deal is just like, as I say, as you're recovering from surgery, that you learn good technique, you do it well, you start light, and that you build up. So I do weight training with women who have lymphedema, and I box with clients who have lymphedema.
Really? Yeah. Box? Oh my God.
Yeah. So my first client who we've done it with, we both have lymphedema, and we're doing it under the, I mean, mine's mild, hers is managed. We're doing it under the supervision of a physio, but
Right.
she, you know, she's wearing her sleeve. Mine's there, and it's so well managed. It's really light. It's not, the boxing isn't irritating it. So with anything, you start little, you start light, you keep an eye on it, and then you build up. So when we were first doing it, we were like, oh,
yeah.
just get gentle.
And now you're really going at it.
Well,
So
she loves boxing. So,
I sometimes do like a sort of an online yoga thing in the morning, and if I'm doing like a side plank with one arm, and I sort of start up like this, if I'm on my surgery side, it just feels really tight, and I'm there and I'm thinking, I don't know if this is a good thing to be doing or not, you know.
So it's the same thing. So I got back to things like inverted yoga positions by starting off on my knees, and stuff like plank, actually, and side plank. I would do a plank with my knees on the floor, or a side plank with my hip on the floor, to get back to that position.
Right.
And, you know, there are ways of modifying exercises so that press ups, same thing. You do a press up against a wall, and when that feels okay, you do a press up with your knees and your shins on the floor, and then you take the feet off the floor, bring your hips forward a bit. There are ways of building it up, and if people can start really gently with any of this, start gently, do it well, which sometimes means exercising in front of a mirror, which some people don't mind but don't like. But if you could look at your posture and really observe what you're doing, and listen to your body. If something hurts, chances are it might be that you're not doing it in a way that you could. Consistency is dead helpful, especially if you're trying to build strength. Build up
and then the other thing I was going to ask is, are people, like, because unfortunately we can't clone you and put you all around the UK. So if there's anybody here, if there's anybody watching or listening to this and think, oh, I wish, how come I don't have a Carolyn at my hospital, who would they speak to about that? Their oncologist or their...
Hard to tell, because I know the spread is very uneven. And one of the things that has completely changed during the lockdown is that there's so much more stuff that's virtual. And I know it doesn't tick everybody's box, but one of the things, have you heard of the Safe Fit trial?
No.
Okay. So this has been amazing, and it's still running. It's an NHS funded academic trial matching people who've had cancer or are being treated now with specialist personal trainers. And they have free virtual one-to-one training. I'm one of the trainers.
Oh, wow.
Just online for a given period.
And it's called Safe Fit. SAFEFIT. I'll look that up. That's really interesting. I didn't know that.
So I don't know whether they're still recruiting. Certainly the people are still going through the thing, but what they're hoping is that might continue, and they're looking at how they can bid for it to be a funded NHS service. So that's something to keep an eye out in the future. There is a register of cancer, we're called cancer exercise specialists, and a qualification, it's an MVQ level qualification, level 4. So you can, to be honest, you can search for cancer exercise specialist, you could search for a level 4 personal trainer, and there is the same in other conditions. So you get level 4 trainers in cardiac and stroke and stuff. Right.
Okay, that's interesting. I'm going to look that up, because I wonder how many people actually know that exists.
And beyond that, I'm not the only exercise specialist working for Maggie's by a long stretch. So most of the Maggie's centres, a lot of the cancer support centres have exercise. When I was first doing it, it was the gentle stuff. It was the yoga and the qigong and stuff. It seems to be getting more active now.
Oh, interesting. I've got another question here from Amy. She said, when they talk about exercise helping to prevent recurrence, how much is needed.
Yeah.
She's still tired post-treatment and feels guilty that she's not doing enough. So how much is...
So the classic prescription is the same as for any other adult. And the idea is that you do cardiovascular exercise sufficient that you're warm and a bit out of puff, which can be a walk, 150 minutes a week. And that on top of that, you do 2 to 3 sessions of exercise that will strengthen your muscles. Now, loads of people, when I say that, they turn off because it just sounds like too much. You could do it half an hour a day during the week and have the weekends off. And for many people, it would be too much. And so you think about that as an eventual destination. I very often try to encourage people to briskly walk a mile a day.
Right.
Which is, depending on your pace, 17, 18, 20 odd minutes. As a start. Lots of, for many people, that's not appropriate either. There's stuff you can do. Well, I'm thinking of people whose mobility is affected.
Yeah.
And it might be that it's affected short term during treatment or in the longer term. And there's certainly plenty that you can do in a chair. You can get, in my book, sorry to plug it, but I deliberately put in chair-based exercise because...
Oh, that's really helpful.
And you can, I've just done a session through Maggie's on Zoom this afternoon, and you can get properly out of puff in a chair. You can tire your muscles, you can need a rest.
Yeah.
So,
that's great.
The prescription, say, is half an hour a day, 5 times a week, thereabouts. But I would always go back to finding the artist to find something that you enjoy doing or that's very convenient.
Yeah. What about sort of competitive sports?
Why not?
Yeah.
So,
but there's no harm in that. I'm thinking like rackets with your arms.
So if we're talking about lymphedema, perhaps, and actually if we're talking about people exercising that are stage 4, or if there's anything going on with bones and bone density, then you'd be looking out for mitigating risk. So mitigating the risk of falling, mitigating the risk of impact injury. So we might not go ice skating.
No. That's true.
But if people love football, maybe football rather than rugby, if people love a sport, then certainly what I would always try to do is find a way to do it rather than rule it out. So it might be that walking football, because you can do that, is something that...
Amy's also just asked, she says, I had Herceptin. Should I be monitoring my heart during exercise?
Wouldn't do any harm as long as it doesn't cause unnecessary anxiety. I didn't have Herceptin. I was only estrogen and...
I had Herceptin.
Okay. So you had scans all the way through?
Yeah.
And did you discuss the results of the scans with a clinician?
There was never anything untoward that came up. So
there's a balance here. I have no clinical qualifications, but there's a balance here as far as I can see between understanding any risk, even if it's just a theoretical risk, but also, we've all got to get on with our lives now. It's the same as lifting weights with lymphedema. We have to be able to live. So the women who I've trained who've taken Herceptin, I've trained women during Herceptin and after, and we keep an eye. She might wear a heart rate monitor, but I've run with plenty of women who... Really?
Even been out running with them?
One of the ladies in my book, one of the people in my book, there's a lovely photo of us both running we ran her first 10K after treatment.
Wow.
Yeah.
That's amazing.
She's the one who boxes as well. She's a good one.
Brilliant. Did you do the 10K as well?
Pardon?
Did you do the 10K as
well?
Yeah,
we did it together. It was lovely.
Oh, what a sense. Oh, she must have felt so chuffed after doing that, after... Flipping out. I'm just scanning through, just checking there aren't any other.
Somebody asked about pelvic floor.
Oh yes, I was only
sorry.
told to do pelvic floor for hysterectomy. No lifting, bending. Same for bowel surgery.
Yeah. And what often happens, and it's very similar to the shoulder mobility stuff and lymphedema, where you're given the immediate cautions, but then not what to do after.
Yeah.
So there are exercises that you can do that take you from do nothing to being more able, and it's the same with some breast reconstruction. So tram and DEP that involve the abdomen. And there are things that you can do. I'd be cautious about too much of a broad thing. And anyway, this is going on camera, but stuff like pelvic tilt. So this kind of thing where you scoot your bum under and you use your belly muscles here. So you ask these muscles to come together and then relax and come together. Things like that. There are gentle ways of doing things. There's a thing called a dead bug, where you lie on your back with your hands and your knees above, and you take opposing limbs forward and back. Now you can start this lying on your back and just doing one arm, and you can lie on your back and I've
done that one before. That's quite hard, that one.
It is, but there are gentle ways of doing it. As I say, I wouldn't want to try to talk to everybody, because that's the kind of stuff that there is a reason why we're cautious, but there are definitely ways to do it. For the people who've had bowel surgery and have ostomies, my fellow author, there's a lovely woman called Sarah Russell, and she wrote the Bowel Cancer Toolkit. And that, for the people who've had bowel cancer surgery, that is really detailed on how you train the core and pelvic floor. The other thing that I do with pretty much anybody or everybody is specific pelvic floor training, because we're not given it. And anybody who's been through pregnancy, they well know this. When we make your way without cancer through menopause, pelvic floor becomes an issue. I mean, be meaning to ask you how you are after your coronavirus, but if you've just had a really massive cough, you may be thinking about your pelvic floor. And the fellas, the fellas who have prostate cancer, many of them have problems with leakage and stuff, and they aren't given enough on how we train our pelvic floor. So and it's the old squeeze release thing. There's stuff in my book about how to train your pelvic floor.
Brilliant. Well, it's having had a flick through, and I'm going to say, because I noticed it says like read it through once and then use it as a guide sort of thing. Then you can dip in and out of it, which is what I'll do. But thank you, and thank you for writing it. I think one thing I've learned, being on this journey, was that I got so much learning from people that have been through it themselves. The fact that you've been a patient, but you've also been the cancer PT specialist as well. It's a complete all-rounder. So, and how do people get hold of the book?
Oh, it's really easy to get hold of. It's all the good booksellers, Kindle as well as paperback. Can I mention 2 types of exercise before we run out of time? Because somebody put a little note on to make sure that I mentioned 5K Your Way. Have you heard of that?
5K Your Way. Is that like Couch to 5K? No.
So it's a really it's a clever small charity. It's an initiative that's arisen out of a charity called Move, by the way, similar to Trek Stock. If any of the people watching are younger, I can't remember what the age group is, but I know I'm too old for it. But Move Cancer and Trek Stock both provide exercise for young people who've had cancer. So 5K Your Way, as I say, is an initiative that came out of Move Against Cancer. And it's a support group where people affected by cancer and their families and actually NHS staff come together once a month and go to parkrun, go to their local parkrun.
Oh my God, what a great idea.
So some people, when I mention parkrun, think that they're going to have to run, and they don't. Parkrun is always 5 kilometres, but they're very frequently laps. And I've known people come and just do the first 2 laps when they're first doing it. But it's sweet because you end up going round with your mates, you know.
Yeah, and it's such a lovely atmosphere there, isn't it?
Yeah.
I need to make a note of that.
Some people are, you know, massive trepidation about the idea of going to what they perceive as a 5 kilometre race. It's really not a race. They tell us that at the start. It's all about participation, and you definitely can walk it, and there will always be other people walking it. So it's not.
So it's called 5K Your Way.
Yeah, it's not at all park runs because it's all volunteer run. So I'm the ambassador for the one in Southwark Park, which is my nearest park run. We get together on the last Saturday of each month, club together, go around in whatever pace we need it to be individually, and then we have coffee and cake after.
Winning. All right. I love that.
You do need to get
so that's a charity. And then was there another one?
The other thing I wanted to mention was Nordic walking, which is walking with poles. I can't describe Nordic walking without doing that. Dead clever. Dead clever because it's cardiovascular exercise, it's weight bearing, it's outdoors, which is so helpful in mental health. It's really sociable because it's at a level you do work, you know, you get lightly out of puff, but you can chat. But moreover, proven at clinical trial level to help improve range of motion in the shoulders of women who've had breast cancer, helps reduce the risk of lymphedema, and helps reduce swelling from lymphedema in anybody who's specifically after breast cancer. Works the belly and the back, but in a way that's not challenging. So the fellas with prostate cancer tend to get on very well with it. It does loads and loads of things. Helps you strengthen your bones, helps strengthen your muscles. If you're looking at attempting to lose weight, if you've gained weight through cancer treatment, you burn up to 40% more calories walking with a pair of Nordic poles than you would on a regular walk. So
that's quite, I mean, 40% more, that's a lot. So Nordic walking.
And it works all of you. So, you know, it's a real full body exercise. Most of the Maggie centres have Nordic walking, and there are
I didn't know that.
There are a couple of national registers. So if you don't have a Maggie centre nearby, most instructors, you can most of them will do a free trial session, basically. So they'll take you out for half an hour to give it a go.
Give it a go, see if you like it.
Yeah.
Wow. Oh, that's really helpful.
It's dead likeable. So I do Nordic walking up on Hampstead Heath with Maggie's in the Royal Free and along the River Thames from Charing Cross, and people just like it. It's not hard,
and it's sociable as well, isn't it? Because you can talk. And it's outdoors, which is, you know,
and it's
a massive tick as well.
On all these different levels. Dead clever.
Well, I think but exercise is just so important. Keep moving, keep active. Whether you've had a cancer diagnosis or not, isn't it? It's just when you have had a cancer diagnosis, it's just harder to get back on that sort of treadmill.
And I would hate anybody watching this, particularly that's experiencing fatigue, because 95% of people who've had cancer have had a cancer diagnosis. 95% of us experience fatigue at some time. So it's a given, you know. And it can and it really knocks people's confidence to exercise because they're afraid of getting tired and they're afraid of getting hurt. But it really helps. So the thing is, you know, just think of ways to make it bite-sized, make it manageable just for today, and see how you feel tomorrow, you know?
Absolutely. Well, thank you. Thank you for motivating us, inspiring us, and all your tips and everything. And
I meant to ask you, Helen, are you feeling better?
Oh, so much better. But I've got to say, it absolutely wiped me out. 11 days I had it for, and it it reminded me of being back in the chemo
Lots of
hellhole.
people have said that. It really, really might. It's taken them back to how they felt with chemo.
Yeah, and the taste of things. That was the other thing, because I remember my taste went as well when I was on chemo, and it was the same when I had that. Oh, it's just awful. But anyway, I feel back on track now. I feel like I could sleep for a week, but apart from that, I'm all good.
Yeah.
So there we go. Get your oomph back. Thank you very much, and I will put a link up where you can get the book as well when I post this chat. So thank you so much for your time, and thanks everybody for all your questions. No, thank you, and do keep in touch with all the things you're up to. And thanks everybody for joining us and for all your questions. And we'll see you again soon.
Cool.
Have a lovely evening, everyone. Take care. Bye bye. Bye, Carolyn.
Bye.